Hi there, it's Uzo Ehion again here from Integrated Clinical Strength and Conditioning. Okay, so the call to action for today, we're going to cover some exercise basics. What we're going to tackle today is the rest period. Okay, now, if you were like me, several years ago, I didn't really bother with the rest period. I gave my patients a dosage of exercise, and really, I didn't really talk very much about the rest. But the rest period between sets might actually just be important. So when we're talking about the rest period and exercise prescription, what are we actually talking about? Well, fundamentally, what we're talking about is this. Essentially, we're talking about the time we take between sets. That is the rest interval. Actually, it affects the acute response, to resistance training. What do I mean by the acute response? Essentially, we're talking about the acute response, so the response, whilst they're doing a dose of exercise, for a very short period afterwards. Now, what we're hoping, obviously, is that when we tackle the acute responses, to resistance training, and let's be honest, fundamentally, in rehabilitation, resistance training is a mainstay. You might call it some other stuff, but fundamentally, it's resistance training. We're moving, heavy stuff, or we're trying to develop tension with bands, or we're using our body weight essentially to develop muscular tension, because we believe, and this is what we're taught, that actually the development of muscular tension, stimulates various adaptation responses. One of them being mechanotransduction, which is actually a change in the structural properties of tissues, which might just be important as physiotherapists and rehabilitation professionals. So, moving back to this acute response. This acute response, hopefully, what we're aiming for it to do is for it to drive some chronic adaptations. So, I guess to categorize rest lengths, we can categorize them into short, moderate, and also long. To put some numbers behind this to underpin it. A short rest recovery is under 30 seconds. A moderate rest recovery is between 60 and 90 seconds. And a long, rest recovery is 3 minutes plus. So let's talk about the short. Let's talk about the short and what some of the research, but also clinically, and anecdotally, what we find. Well, you know as well as I do, if you are training somebody or you've given somebody an exercise to do, and we are trying to push, and we're trying to push adaptations, and we're asking that patient, we're asking them to work, up to a point of volitional failure or fatigue, unless this is a skill acquisition type task or a motor learning type task. So we're not wanting them essentially, to work to failure or even close to failure for that matter. Then, in essence, a very short dose, a very short recovery period, what it will tend to cause is an increased accumulation of metabolic metabolites. So an increase in hydrogen ions, and lactic acid, and so on and so forth. Now, that may be exactly what it is you want to achieve, because actually what you're trying to do is you're trying to drive some positive adaptations within the metabolic system. You're trying to drive the energy system. For most physiotherapists, essentially within the early to moderate stages of rehabilitation for patients, we're not trying to drive that. And so I guess the problem with very short reps and this high metabolic accumulation is essentially what we see a decrease in training volume. So why is that important? The reason why it's important is because what we know is that we need a certain amount of volume of training, so we call it volume load. So that's the load, the repetitions and the set. You put that together and that gives us, essentially, if you can calculate a certain amount of kilograms that have been moved or poundage and so on and so forth. But for us, even if we're using elastic bands and we can't quite quantify that, what we're looking for is a certain volume of load. because that will cause positive adaptations in both tissue, in terms of morphology, so cross-sectional area, and also the material properties of those tissues. So the tissue's ability to mechanically do certain things, which might be important for our rehabilitation. No, stop. It is important for our rehabilitation. Not might be, it is in most cases. But the difficulty what we see here is, and certainly there's some studies that have shown, you can almost get a 50% reduction in training volume, okay? So for example, if you use 3 sets of 10, we know about 3 sets of 10, don't we? Okay, so over 3 sets of 10, you can see what you see is a progressive decrease in load over each set. So if you had your patient doing 3 sets, okay, and you were giving them a 30-second rest and you actually wanted them to work to a point of fatigue, what you see is actually they can do less and less and less and less and less and less and less. So the total volume is less, okay, and that might not be useful for us, okay, as physiotherapists and rehabilitation professionals. What about long duration rest periods, so 3 minutes and beyond? Well, that clearly has utility dependent upon what the end outcome goal is. And you'll see in previous videos, I talk about what is your outcome. Define the outcome that it is you're chasing, because that makes life so much easier in terms of the modality that you'll choose, and also the assessment technique that you're going to use. But that's for another video. So long duration rest periods means that you're able to sustain. This is often what it means. It means that you can often sustain the volume, okay, and the amount of tension for long periods of time. So what you get in essence is it's much easier to maintain a high level of muscle tension, okay, over all of the sets if you have a very long rest, okay, and that may be useful. It might not be that practical for the patient, taking a 3 to 5 minute rest in between sets just because of time, of course. But what it does mean, it means you can develop a high amount of tension and you can maintain that high level of tension across all of your sets because you have sufficient recovery for that to take place. But like all things, okay, in clinical practice, okay, we're often working in non-ideal conditions. So there needs to be a halfway house. So maybe actually the moderate rest period of 60 to 90 seconds might actually be the best compromise. And let's think about why this is. So for the vast majority of us as physical therapists and rehabilitation professionals, certainly in the sort of acute to middle term of our rehabilitation, often what we're trying to do is we're looking for some sort of change in tissue morphology. So, if it's a post-surgical problem, like an ACL reconstruction, a knee replacement, a hip replacement, or such like, often what we're doing is we're trying to improve, okay, the force generating capacity of that muscle, which means we're looking ideally to improve the cross-sectional area, to reduce atrophy, and to improve the fortunes of that patient so they can then go on to do other activities. But also it may be that actually part of our rationale is that we want to improve connective tissue or tendon mass, okay, in a tendinopathic condition, or it might be that actually we're rehabbing after peripheral ligament injury, okay, maybe in the finger, wrist, or maybe or the knee or such like, or the shoulder even for that matter. So what we're aiming to do is improve, okay, the connective tissue mass, okay, by using mechanical transduction. So then we can use hypertrophy based modalities, okay, to do that, because we know that it will improve muscle mass, and actually if it will improve muscle mass, there's a reasonable chance it might also improve tissue mass, connective tissue and tendon mass. So what it then actually means for us is that actually, and what's been shown, I guess, is that the ideal here is to go for this moderate load. Why? Because what you get is you've got sufficient recovery that you can develop enough tension, which we know is a driver for change in terms of muscle hypertrophy, but also muscular strength as well. But equally as well, you'll get some metabolic accumulation, Okay, so you'll get some metabolic accumulation as well, okay, but to a lesser degree than say the very short rest period. And why is that important? Because we know that metabolic accumulation is also a relatively potent driver for muscle hypertrophy. Okay, so it means that you can get the best of both worlds essentially by going for a moderate rest period. I think the key take home here is is that rest periods matter. They matter because if we want to ensure that we get enough volume in, then rest periods do matter. Equally so, it may be that actually your goal is to work on work capacity, or endurance and muscular endurance, and then therefore actually, having a short rest period has clear usage. But the key call to action here is it's important for you to think about why you're given a particular rest period. For the vast majority of the cases, if it's to improve muscle, tendon and connective tissue mass, then actually a moderate rest period of 60 seconds to 90 seconds is probably where you need to be. It's probably where you need to be. So you heard it here first. Rest period. Do think about your rest periods in terms of your basic exercise prescription because it's important. Join our community. Thank you for listening. Let's put rehab back into physio rehabilitation. Bye for now.